like to focus on lifestyle instead. What are your lifestyle choices? And making good lifestyle choices, what will follow is an optimal weight level, actually. Weight and fertility. We often get asked this question if weight affects fertility, and overweight, underweight, what and how are these connected? Well, good questions. So a woman who is overweight can struggle to get pregnant for multiple reasons. It doesn't even have to be her weight. There are overweight women who get pregnant seamlessly, it seems like. And unfortunately, oftentimes they do have more problems with pregnancy and delivery. So we won't get into that today, but women who are overweight can struggle with fertility for multiple reasons, with the increased adipose tissue that actually causes inflammation, additional inflammation in a person's body. And any inflammation can negatively impact fertility, as we talk about very frequently, negatively affect all our systems, basically our hormonal systems, the implantation can be a hostile environment in the uterus if our inflammatory system is off. So the inflammation with somebody who is overweight can negatively affect fertility, as well as also being overweight can negatively influence hormones. Specifically, adipose tissue ends up making more estrogen, or creates an environment which is higher in estrogen, and that in itself can throw off, so to speak, a woman's hormones and make their cycles such that fertility is more difficult or interfere with other aspects of that person's fertility and health. And weight affecting fertility as far as women who are underweight. We see this a fair amount in high intensity athletes, so maybe long distance runners who their bodies go into a state of stress because they have depleted all their nutrients and energy, and so their body shuts down and focuses that energy where it's needed versus focusing the energy on reproduction. So very often we see that these women have amenorrhea or do not have cycles, and a way of working with those women are to adjust their exercise so that they're not in a state of stress and that their bodies can replete their nutrients that they need and help increase their body fat so that their hormone levels are more balanced. And then this will help lead those women to starting to cycle again. And we want a healthy hormone balance so that their bodies are ready and primed for fertility and having a healthy baby, versus shunting all that energy into doing other things because their body is so stressed. Honestly, we don't like to look at those numbers. We don't like to focus on a number because everyone's different. Obviously, people have different heights, different bone structures, and each person specifically, that answer will be very different or could be very different for sure. And so we like to focus on lifestyle instead. What are your lifestyle choices? And making good lifestyle choices, what will follow is an optimal weight level, actually. And when we're healthy, we have healthy babies. So that's what we like to focus on for both the male and the female, a healthy weight. And as I mentioned, that number is different for everybody. So to focus on, how do we get to a healthy weight? What's the best way to maybe lose weight? Or some people are in situations to gain weight and to be in a healthy state of weight and healthy state for all our body systems. So we like to look at lifestyle. One of the first things we like to do is to present the couples with a fertility, we call their fertility reboot food plan. So important to focus on whole foods, meaning avoid processed foods, to eat organic as much as possible, to have plenty of protein and healthy fats, We also want to avoid inflammatory foods, which include refined cane sugar, gluten, dairy, to name a few. And then we tell people that it's possible after being on this food plan for a few months that we can add back some of those things to see how your body reacts. And not everyone has an inflammatory reaction, so to speak, to some of those foods I just mentioned, but those are very common foods to cause inflammation for people. So we like to start with food when we're talking about finding that healthy weight. So eating very clean, very healthy, and then also sleep. Sleep is super important. That's when our hormones reset. That's when we repair our tissues. The more healthy we can get, then the easier it is to maintain a healthy weight, because we have energy, we feel good because our bodies had time to repair. So sleep is a big part of that. And with sleep, I could talk about, but we want to have try to get 8 hours a night of sleep, and we want to set ourselves up for sleep in that we have a good sleep schedule. So we go to bed the same time, wake up about the same time every morning. We have the same routine to wind down. We have it really dark at night. We avoid screens right before bed. We expose ourselves to light in the morning. All of this is going to help us live a healthy lifestyle and progress our bodies to health. And then it makes it easier to sustain a healthy weight as well. And then stress is a big piece. So we want to look at stress resilience. We're always going to have stress in our life, but stress resilience. So what do we do on a daily basis to help our bodies go from that possibly high sympathetic level of stress to the parasympathetic level where you're more relaxed and able to deal with things. So when things come at you, if you're coming from a parasympathetic state, you have some room to go up a bit without stressing our body too much and getting into that fight or flight stress path, which when we get into that, then it negatively impacts our sex hormones and so many other things. And cortisol throws off we want to eat often if we are in a high cortisol level state, if we're stressed out. So just feeling better and having more stress resilience will help us maintain a healthy weight. So we have patients and clients come to us when they start the Fertility Reboot food plan after a few weeks saying, yeah, I lost this weight, I wasn't expecting to. And we do see that, and not always, but if somebody is overweight or slightly overweight, sometimes we do see that happening, because just cutting out things like processed food, refined sugar, things that our body converts quickly to glucose and then sometimes stores as fat, then when we remove those pieces and have mostly clean proteins and healthy fats and lots of vegetables for the antioxidants and the nutrients, we see just people's bodies balancing out. So losing weight sometimes is part of it when it's not necessarily a goal, but it's just a part of being healthy, and it comes with eating healthy and on the Fertility Reboot food plan. If you'd like to learn more, please like and subscribe to my channel.